Hello, I'm Dr. Tanu Mishra. I'm going to summarize the implant in a very simple and easy way. Clinicians find it very difficult to place the implant in their clinic because of the different type of the drills and its complication. But today I'm going to burst the myth that implant is not that tough. Dear clinicians, today I'm going to summarize the implantology from the first drill up to the prosthesis. We know that implant has a three-part. First, the implant which is present inside the bone. Second is the abutment, and third is the prosthesis. Let's talk about the implant diagnosis and the treatment plan. Before placement of the implant, you should know the four important points, which is type of bone, bone quality, bone quantity, and the vital structures around the bone. After that, you can decide the site which is favorable for the implant. Now we have decided the site where we are going to place the implant. So let's talk about the physio dispenser and the different type of the drills which clinicians find it very difficult. This is physio dispenser. As you can see, this is the handpiece of the physio dispenser. This is a foot control. This is saline, and this is the physio dispenser, where you can maintain, you can change or regulate the speed, the torque, and the saline. With the help of the coolant, you can increase the saline flow. You can increase or decrease the speed, and you can regulate the torque also. The ideal speed for the for implant to place into the bone is the 800 to 1200 RPM, and the torque is 20 to 35 Newtons centimeter. Okay? So this is all about the physio dispenser. There are the different type of implant drills are available in the market. We have the two. As you can see, this one is the Norris and this one is the EnoSub. Let's talk about the drills in the EnoSub. See, this is the path drill, as you can see, and these are the subsequential drill. The function of the path drill is to increase the length inside the bone, and the function of the subsequential drill, these are the subsequential drill, the function of these is to increase the width inside the bone. This subsequential drill is not going to make any changes into the length of the bone because of the two reasons. Because it has its own inbuilt stopper, and there is the blunt end at the tip of the drill. As you can see, there is a photo you can see there. Because of the two reasons, these subsequential drill are not going to change the length but the width. Start. Apart from the path drill and the subsequential drill, implant kit also have these kind of drills. Let's see. This is the parallel pins to check the parallelism between the implants. This is the implant hex driver. This is the hex. We are going to screw the cover screw of the implant with the help of this hex driver. This is the implant hex driver. This is used with the help of handpiece, and these are used with the help of ratchet. As you can see, these are the different types of the hex, implant hex, and these are the cover screw hex. And this is the parallel pins, and all these are the subsequential drill, and this is the path drill. Okay? Now, as you can see, there is the number on the kit, implant kit, 3, 3.5, 4, 4.5. These are in this direction, there is the increase in the width of the subsequential drill, and in this direction, as you can see, there is a number also, 2.2 into 7, 2.2 into 8, 2.2 into 10. These are in this directions, there is no change in the width, but there is a change in the length of the drill. So this is the 8, length is 8 and width is 3.5. So in this directions, there is the increase in the width, and in this directions, there is the increase in the length of the subsequential drill. And according to the space, according to the measurement, we are going to use the subsequential drills. This is the implant kit EnoSub. Let's talk about the path drill first, and these are the subsequential drill. This is the path drill, and these are the subsequential drill. With the help of the path drill, as you can see, this is the path drill. With the help of the path drill, we are going to make we are going to increase the length inside the bone. This is not going to increase the width. This is only going to increase the length. That is, bone cutting is done with the help of the part drill. And with the help of the subsequential drill, we are going to increase the width inside the bone. See, as you can see, there is a different type of number. Different numbers are there. 2, 3, 3.5, 4, 4.5. And in this direction, there is the increase in the width. And in this direction, there is the increase in the length of the drills. See, this one is the length of 8, 7, 8, 10, 12, 14. And in this direction, there is the increase in the width of the drills. Accordingly, we are going to choose our subsequential drill. As you can see, there is the extension, drill extensions. Because you can see, this is the pilot drill. We have talked about that. These are the subsequential drill. Let's talk about the drill extension. This is nothing but the drill extensions. These are the implant hex driver. This is strong. This is short. This is long. These are used with the help of the handpiece. This is also used with the help of handpiece. These are also all 6 are the implant hex driver. And this is nothing but the screw hex driver. We are going to use, with the help of this hex driver, we are putting the screw on the cover screw on the top of the implant. And this is the parallel pins. As you can see, this is the parallel pins. This is the implant drivers, hex drivers, implant hex drivers. These are used with the help of handpiece, and these are used with the help of ratchet. And this is the drill, this is the extension, and these are the subsequential drill, and this is pilot drill. Now let's talk about the implant first drill. Now with the help of these drills, we have placed our implant. So this is the scenario where we have placed our implant inside the bone. As you can see, the level of implant inside the bone. Now after the placement of the implant with the help of hex driver, this is the hex driver. I have talked about this. With the help of this hex driver, we are going to take the cover screw, which is present at the back side of the implant hex driver. Now we have taken this cover screw, we put at the top of the implant in a clockwise manner. As you can see, in a clockwise manner, I have placed the cover screw on the top of the implant. See, this is we have placed the implant inside the bone successfully. Now patient is recalled after 3 months, because as we know that healing of the bone takes place 3 to 6 months. So we recalled our patient after 3 months to see the osseointegrations, that is the integration of the bone with the implant. It has come to you after 3 months at this stage. As you can see, there is the growth of gingiva over the implant. You are not able to see. In this case, you can see the cover screw, but ideally you are not going to see the implant or the implant cover screw with your naked eyes. You have to remove the gingiva on the top of the implant. So there are the two techniques. You are going to, with the help of that, you are going to remove the gingiva on the top of the implant. First, you can use with the help of the physio dispenser. See, there is the tissue punch kit. As you can see, with the help of these drills, you can remove the gingiva on the top of the implant. This is atraumatic. Patient is not going to feel any pain after using this. See, and the second is the conventional method. In this, you have to remove the gingiva on the top of the implant. In the conventional method, you can use the normal BP blade to expose the gingiva, on the top of the implant. For this, you can take the X-ray. You can locate with the help of the probe. Take the X-ray. After location, you can remove the gingiva on that area. See, this is the function of the tissue punch kit and the exposure of the gingiva. Now let's talk about the healing abutment. The function of healing abutment. After the removal of the cover screw, see, we have exposed the gingiva on the top of the implant with the help of tissue punch kit or with the conventional method. After that, after the exposure, we are going to remove the cover screw by using this hex driver we just insert into the cover screw and we move into the anti-clockwise direction and we remove the cover screw on the top of the from the top of the implant. See, this is the cover screw I have removed. Now at this place I am going to put the healing abutment on the top of the implant. It's not going to add any benefit to the implant, but it just increase the aesthetic. It is only helps to increase the aesthetic of the implant. Just that is, it is used to form the gingival collar around the implant. It is not going to add any benefit to the implant success. See, this is nothing but the healing abutment. As you can see, this is healing abutment. I'm going to take this healing abutment with my hex driver. I have inserted my hex driver there, and now I'm going to place this healing abutment into my implant to form the very good gingival collar. See, in a clockwise manner, I'm inserting my healing abutment into the implant, as you can see. See, this is the healing abutment, and the function of healing abutment is just to make the gingival collar on the top of the implant. After this stage, patient is recalled after 1 week, because as we know that the soft tissue healing takes place in 8 to 10 days or 15 days. So we recall the patient after 1 week. After the patient is come to you, after 1 week. Now what you are going to do at this stage? Patient is come to you at this stage. Now what we are going to do is Now we are going to remove the healing abutment. See, at this stage, what we are going to do is we are going to remove the healing abutment. See, I'm going to remove the healing abutment, and at this place, I'm going to place the abutment, final abutment. See, this is the I have inserted the final abutment onto my implant, as you can see. Same way, inserted my hex driver in a anti-clockwise manner to remove the abutment in an anti-clockwise manner. Now, see, this is the implant on the top of which I am going to place my abutment. See, in a clockwise manner, I am going to place the abutment. See, in a clockwise manner. If we have decided that we are going to give the patient cement retained prosthesis, now what we have to do is we have to take the impression at this stage only. We have to take the impressions and we make the prosthesis and we can cement the prosthesis on the top of this abutment. But if we have planned that we are going to give the patient to a screw retained prosthesis, then what we have to do is in that case we have to take a open tray impression technique. What I have talked about in the case of cement retained prosthesis, now this is the closed impression technique, closed tray impression technique. But for the screw retained, we are going to make a open tray impression technique. So in case of the open tray impression technique, we have to know about the impression coping, implants analog, and the gingival former. Let's talk about the impression coping, implant analog, and the gingival former. To make a open tray impression technique, we required this. This is nothing but the impression coping. This is the impression coping. This is the implant analog. You can see this is the implant analog. And this is the gingival former. This is the gingival former. This is the gingival former. See, this is the gingival former. You are not going to do anything with this, but I'm just explaining this to you. Now let's talk about the open tray impression technique. At this stage, you just have to put at the stage of gingival former, you have placed the gingival former on the top of the implant. You have to make the impression. We send it to the lab. They give you the spatial tray. They just give you the special tray where there is they give you a special tray, and with the help of special tray, you are going to take. Bhaiya, 1 minute hata. So let's see what are the steps in the open tray impression technique. At this stage, we are going to make the impressions. We send it to the lab. They give you a special tray. Then with the help of special tray, you are going to make the impressions like this. You can see the impression with the help of putty and the light bodied impression you are going to take. And after that, what you have to do is, see, you just remove this gingival former, this healing abutment. See, I'm just going to remove the healing abutment. Now I'm going to place, because now I'm going to make an impression with the help of special tray. So what I have to do is, I'm going to engage my impression coping on the top of the implant. And at this stage, I'm going to take the impression with the help of putty with light bodied. See, I'm going to take an impression. Now you can see the impression coping is come into the special tray, into the impression. As you can see, this is the impression coping and it is come outside. As you can see, now I am going to put my implant analogs on the top of the impression coping. See, this is nothing but the implant analog, as you can see. And at this stage, I am going to pour, and also I'm going to make the gingival former at this here. I'm going to make the gingival former, and after that I'm going to pour this cast, where this implant analog is come inside the cast. And I can make the zig trial on the top of it if there is the multiple implants are there. So I can make the zig trial. The function of zig trial is just to make the guided, it just to decide the angulations or just to transfer the angle of the cast into the mouth. After your open tray impression technique or zig trial, finally you will get your screw retain prosthesis. This is the screw retain prosthesis, where I'm just engaging my hex anti-clockwise. Now in this hex, anti-clockwise. Sorry. See, this is screw retain prosthesis. As you can see, this is screw retain prosthesis. This is hybrid denture, I can say. Hybrid prosthesis. And in the same way, with the help of by engaging my hex like this, and in the clockwise direction, I can re-screw my prosthesis. Now, this is the prosthesis which we have get through the open tray impression technique, which is the screw retain prosthesis. Now we have talked about the cement retain prosthesis. With the help of closed tray impression technique, we have get this. This is the impression final. This is the abutment. On the top of the abutment, we are going to place the prosthesis like this. So this is the cement retain prosthesis, and this is the screw retain prosthesis. Now let's talk about the different type of the drills. Apart from all these drills, this is complete implantology. You are not going to get anything more apart from this. I don't have zig trial right now with me, but the function of zig trial is just to guide the angulation, is just to make the angle or transfer the angle of the cast into the mouth. This is the only function of the zig trial, which we have done in case of the multi teeth. If there is the only one tooth, one implant is there, so we are not going to use the zig trial. Zig trial is for the multiple implants. Now let's talk about the different type of the drills. As you can see here, these, apart from this drill, these are the special drills, as you can see. This is the Densa drill. With the help of the Densa drill, you can lift the maxillary sinus. Now this is the will drill. With the help of this drill, you can split the ridge into two parts, buccal or the lingual. As you have seen the split ridge technique now, so we have used this drill, will drill into that case, on that case. And this is the densa bore. This is a different size of the densa bore. This is nothing but the pilot drill only, but different sizes of the pilot drill. And this is the parallel pins. I have talked about this into the implant kits only. These are the different kinds of a drill. This is all about the implant. I have summarized each and every step of the implant into this video. This is going to be a very short video where I have explained each and every points of the implant. If you want to know more about the implant, you can join the Ahead Dental Academy, where you get the hands-on practice and the more informations about the and detailed informations about each and every step. Thank you so much.